The Australian market is a very attractive healthcare market for many New Zealand companies, and many New Zealand companies are already quite active in the marketplace. The Australian healthcare market is currently $124 billion in recurrent spend, and that is divided across the states and territories. Health IT is $1.5 billion, the medtech, excluding consumables, is $1.9 billion. So as you can see, it's quite a large market. Australia is also tackling some very difficult or problematic healthcare issues right now. Ageing population is a significant issue that's putting pressure on hospitals. It's also putting pressure on aged care facilities and indeed creating many challenges for ageing in home. We have an increasing obesity problem, and this obesity problem now is becoming apparent at younger and younger ages. We have very remote and dispersed communities across the country, and they have significant and ongoing problems accessing proper health care services. And this is particularly compounded in Indigenous communities. So therefore, lots of difficulties, not to mention the sheer runaway costs of the health system that countries around the world are trying to contain. However, it is a mistake to think that the Australian market is a single market or that entry into Australia will be easy. You must view Australia as 8 states and territories, or indeed you must view it as a high-density population along an eastern seaboard, a very thinly populated centre, and of course the western seaboard as well. A key consideration for companies entering the Australian market is to look at the concentration or the market dominance of players who are already operating in their sectors. Now, some of these subsectors in the health market are fairly fragmented, and this would suggest a certain market entry activity or strategy, while others are quite dominated by a small number of players. For instance, in biomedical products where 5 players account for 70% of the market, or indeed in clinical information systems where there's 1 player alone which dominates nearly half the public spend. So players must think about that when they're entering the market and adjust their strategies accordingly. If you're entering a concentrated market, you must be thinking about how we deal with these players and can we actually leverage them for our own benefit. Think about partnering programs. At a minimum, you must be thinking about how your product or service integrates into their product or service. Or indeed, think about complementarity, where you can add value to an existing product or service through your own product rather than compete with it. And if you're doing that, you may even be looking at products which are traditionally outside of the health market. Many companies ask me, what is the single most important thing I must do or consider when entering the Australian market? And of course I say there's no single thing. But if I need to distill just a few key elements, I would say it's preparation, planning, and defining what success is. You must be prepared for the long haul, and that means you need to understand from a time and a person and a dollar perspective how much you're going to invest in the country. Defining success, I think, is also very important. If it is a long-term investment, then you need to understand, where do I want to be in 3 months? Where do I want to be in 6 months? Where do I want to be in 18 months and 24? And be prepared to have that time frame. That also means you might need the capital to support that time frame as well. When navigating public procurement, you must understand the procurement process. And unfortunately for companies, that is highly dependent on the state or territory you're in. The processes are not the same across the country. A lot of procurement is done off the back of existing contracts or panel arrangements. In some instances, if you're not on those contracts or panels, you can't sell. On other occasions, and depending on the size of the tender, you may be able to enter into the market. So you need to understand the procurement processes, and you need to make sure that you're viewing the tenders that are coming out for the different hospitals and the hospital networks. However, I don't want to give the impression that navigating procurement is purely a process. You enter in here, you go through these activities, and you come out at the end with a sale. It's not going to work like that. You need to start actively marketing your product or service to a variety of stakeholders in the hospital network. Think about a consensus sales model. Who are the influencers in the sales process? Who are the ones that control the dollars? Who sign off? Also, who can veto a sale? So that becomes quite a complicated solution sales process where you need to manage the interests of several stakeholders, and while their interests may be aligned, they won't exactly be the same. The health market, of course, is a market that's dominated by regulation and legislation, and companies need to understand how this impacts their own product or service. Now, for some devices, depending on the classification of that device, getting approval or certification of that product can be a lengthy process. I was quite surprised during the course of this research with how much success New Zealand companies are already achieving in the Australian health and health IT markets. Australia already imports a lot of its health product and service from international and overseas companies, so it's quite comfortable from buying from companies which are not Australian. Being a New Zealand company will not be a disadvantage, and indeed the reputation of many New Zealand companies is quite high in the sector. However, you can't rely on it to be a value proposition either. You must be able to demonstrate capability and the ability to service the market on the ground. Capturing the Australian market will not happen overnight, and it won't happen by accident. Companies need to prepare and plan, and your entry strategy must be focused and you must be determined to be there for the long haul. However, if a company is prepared to make that investment, then you will gain access to a market many times the size of New Zealand, being able to give your company a basis for sustainability and for further growth, and indeed perhaps further growth into other overseas markets.